Hi, my name is HSchiavone. Today I will be reviewing the Test of Written Language 4th edition. The Test of Written Language 4th edition is commonly known as the TOWL-4. The date of publication is 2009 with the authors Donald Hamill and Stephen Larson. The publisher is ProEd and the price is $274. The population range is for children ages 9 years old through 17 years old. It is a comprehensive diagnostic test to identify writing problems and to determine the degree of the problem. There are many components of the TOWL-4. The examiner's manual, large colored picture cards, record story scoring forms, the student's response booklets Form A, the student's response booklets Form B, supplemental practice scoring booklet, and the storage box. The test standardization used a sample of 2,205 children, 51% being male, 49% being female, with their ages ranging from 9 years old to 17 years old, and their dominant language being English. Other characteristics of the sample population include parental education, geographic regions, race, hearing, vision, and cognitive status. The construct validity for the TOWL-4 is broken down into 6 sections: relationship to age and grade, relationship among the subtests, relationship to intelligence, differences among groups, factor analysis, and item validity. Each section has their own testing method to determine construct validity, and each section was determined to have construct validity. Content validity. The TOWL-4 demonstrates 4 types that show content validity within the test. The first one, the TOWL-4 describes each of the subtests' content and format. Number 2, the TOWL-4 describes procedures used to pick out the pictures needed for the spontaneous writing subtest. 3, the items in the TOWL-4 are empirically tested for their validity. And number 4, the TOWL-4 uses the results of the differential item functioning analysis to show the test items of lack of bias. As in construct validity, each section of the content validity has their own testing method for determining said validity. With the tests used, it has been found that the TOWL-4 has concurrent validity. I will now be discussing predictive validity. To prove predictive validity in the TOWL-4, the test was measured against 3 criterion literacy tests. After the data was collected, the TOWL-4 scores were correlated with the criterion literacy measure. It was then compared the means and standards of the TOWL-4, and finally, a series of positive predictive analyses were performed. All results show the TOWL-4 has predictive validity. The TOWL-4 does not discuss concurrent validity. For test-retest reliability, the TOWL-4 uses 84 students. In order to study age-based norms, the students are split into 2 groups, and to study grade-based norms, the sample was again divided into 2 groups. Both forms of the TOWL-4 were used on the group with a 2-week time span in between each testing. Of the 40 coefficients for the combined sample, 93% surmount 0.80 and 54% surmount 0.90. The results were correlated and found that the size of the coefficients were similar and large enough to determine that the TOWL-4 has sufficient test-retest reliability. For parallel forms of reliability, the TOWL-4 uses immediate and delayed administration to determine reliability. For immediate administration, the correlation coefficients show the relationship between the 2 forms exceeded 0.8. The delayed administration is used when the students were administered the 2 forms and then retested 2 weeks later. For age-based norms, the majority of the coefficients in the sample rounded to or exceeded 0.8. This shows that the TOWL-4 has parallel forms of reliability. Interjudge and interjudge reliability. 2 scorers who are familiar with the TOWL-4 are needed to independently score a set of tests. Once the results are determined, they are correlated. The average of 20 coefficients passes the 0.90 magnitude, and the story composition subtest results are in the 0.80 range. Due to these high coefficients, it is accepted that the TOWL-4 score is reliable. The TOWL-4 can be taken in 1.5 hours. There is no time limit for this test except for the story writing portion, which is required to be taken in 15 minutes. For administration description, the administrator must read the directions exactly as they are stated in the manual, monitor the student's answers on the contrived subtest, and stop him or her when the ceiling has been reached. The spontaneous subtests are scored afterwards. There are 7 subtests. Subtest 1, vocabulary, 2, spelling, 3, punctuation, 4, logical sentences, 5, sentence combining, 6, contextual conventions, and 7, the student will write a story and then be evaluated on its composition. To prepare to administer the test administrator needs to do the following: familiarize themselves with the contents of the test manual, practice scoring with the sample stories, use the instruction in the manual for either an individual or a group, administer the measure to at least 3 students prior to administering it to a real patient, be sure that you are testing in a distraction-free environment, and explain the purpose of the test to the student prior to administering the test. The TOWL-4 is useful for identifying writing abilities of English speakers between ages 9 through 17 years of age. Raw scores can be found in Appendix A and B. Percentile ranks are found in Appendix A, B, and C. Standard scores are found in Table 4.1, and age equivalent, grade equivalent scores are found in Appendix D. There are no percentage scores for the TOWL-4. There are a few limits that the TOWL-4 presents. The test is only valid for students between ages 9 through 17. The test is administered in an artificial environment. It does not account for bilingual individuals, and it does not indicate the receptive or expressive abilities of the sample population. A few cautions when administering this exam. Administrators of the test must be well trained. Administrators of the test must read instructions exactly as they appear in the manual, and individuals being tested must be similar to those in the sample population. Thank you.